Hearing a heart murmur during a routine sports physical or a well child checkup can be nerve-wracking for parents, but for clinician, it is usually a puzzle of acoustics. About 75% of children have an innocent murmur at some point during development. The goal is to differentiate the musical sounds of normal flow from the harsh sounds of structural turbulence. Innocent murmurs are caused by normal blood flow through normal structures. Think of it like the sound of water rushing through a garden hose. Sometimes you hear the vibration, but the hose isn't leaking. Here are the key acoustic features of innocent murmurs. Timing, always systolic, occurs between S1 and S2. An innocent murmur never occurs during diastole. Pitch or quality, characteristically vibratory, musical or twanging. The classic stills murmur sounds like a plucked string. Intensity, usually grade 1 or 2. Crucially, the intensity changes with position. It often softens or disappears when the child sits up or stands. Location, usually loudest at the left lower sternal border or the pulmonic area. Pathologic murmurs indicate structural heart disease such as a hole in the heart, VSD-ASD, or a narrowed valve, stenosis. Here are the key acoustic features. Timing, any diastolic murmur is pathologic until proven otherwise. Additionally, hollow systolic murmurs lasting the entire duration of systole are high risk. Pitch and quality, described as harsh, blowing or rasping. It sounds more like static or wind than a musical note. Intensity, grade 3 or higher. If you can feel a thrill, that's a physical vibration on the chest wall, it is grade 4 and most likely pathologic. Radiation, does the sound travel back to the axilla or up into the neck? If it radiates widely, it likely points to a structural issue. Here is a comparison at a glance. Timing, mid-systolic only, innocent murmur. Diastolic, hollow systolic or late systolic, likely to be pathologic. Musical, vibratory, sweet quality, likely to be innocent. Harsh, blowing, grinding, likely to be pathologic murmur. Grade 1-2, that is quiet murmur, innocent murmur. Grade 3-6, loud murmur, pathologic. Occasionally certain conditions with the quiet murmur also can be pathologic. Position, changes or disappears with sitting, innocent murmur. Remains constant, pathologic murmur. S2 sound, normal splitting for innocent murmur. There can be fixed split or single S2 in pathologic murmur. There are some variations to all these, which is a higher level education. Even if a murmur sounds innocent, we always correlate with the clinical picture. Poor weight gain, cyanosis, or fainting during exercise warrants an immediate echocardiogram.